The vagus nerve is the 10th cranial nerve. We have 12 cranial nerves which come out of the base of the brain, and they feed the face and all the organs, the sensory organs, eyes, ears, tongue, the 17 muscles of the tongue, muscles of the jaw and so forth. So they're very, very important, the 12 cranial nerves, and the 10th cranial nerve is the vagus nerve, which is super important. The vagus nerve was thought to be one nerve until Stephen Porges, with his PolyVagal theory, had a more careful look at it and figured out there were two key elements to this nerve, which he called the dorsal vagal and the ventral vagal. So this 10th cranial nerve that comes down from the base of the brain and feeds into the body is two nerves, the dorsal vagal and the ventral vagal. And I want to talk a little bit about those functions to get really quite clear about that, because they are so important. The ventral vagal first feeds into primarily the lungs and the heart, and some of its nerves go down into the belly, so it crosses over down into the belly. And the dorsal vagal feeds mostly into the intestines and the belly, with some of its neurons going into the chest. So we have these two key areas. So the cranial nerve comes into all of that. And the vagal nerve affects then the lungs, the heart, and all of the intestinal organs, all of the abdominal organs. Right. Now what do these nerves do? Well, the vagus nerve comes in to slow down heartbeat rate. So it relaxes the heartbeat rate. It's involved in feeding into the lungs as well. And so the ventral vagus nerve is it's active when we are relaxed in social engagement. So we can be talking, the cranial nerves up here operating, we're listening, we're paying attention to somebody else's face, the micro movements of their face, because we have a thing called theory of mind. We're constantly trying to mind read who we're talking with to see if they're, one, safe, secondly, what are they really thinking? We do that all the time, and it's normal. So our brain's busy looking at somebody else's face, looking at the non-verbal language. And we're also listening, we're also formulating thoughts and talking and chatting about stuff. It's fairly relaxed social engagement. Some people don't do that very well. Some people really struggle with that. We'll come back to that in a minute. The dorsal vagus comes in when we have maybe eaten a very big meal and we're relaxing and going into rest and digest, deep parasympathetic rest and digest. That's the first element of it. Now, dorsal vagal function also can be switched on when we have been stressed out so much that we collapse. We collapse into immobility, into freeze. We collapse into flop, where we cannot respond to a complex, difficult situation. We collapse into immobility in bed, maybe for days or weeks, where our body goes into difficulty and pain and distress. So dorsal vagal, at its extreme end, can be extremely problematic. Ventral vagal, when we shift out of that, at the top end of that, we go into sympathetic, into stress response, which is fight and flight. So we can go into fight and flight, which is the stress response. We can go all the way through stress into collapse, which is the dorsal vagal response. Now there are hybrids between these three responses. Ventral vagal and dorsal vagal are both parasympathetic, and then which is the relaxation kind of end of things. And then there's the sympathetic, which is the fight and flight, the stress end of things. There are hybrids between them. So we can go from sympathetic into collapse. When we are in ventral vagal and a combination of dorsal vagal as well, that's when we're super relaxed. Maybe we're lying in bed with somebody engaged in post-coital pillow talk. That's the perfect opportunity for the hybrid between the dorsal vagal and the ventral vagal to be active then. When we're in a hybrid between ventral vagal and sympathetic, we're playing sport, we're playing football or cricket or martial arts. So it's in that kind of edge between social engagement and stress. It's not a war zone. There are rules. We know full well you won't be hit under the belt, or there are rules there. So that it's not a war zone. It's not complete sympathetic. Yeah? It's not a total stress response. So that is sport. So we have these different ways of operating, and the nervous system operates and enables us to operate in that way. We've got relaxed, chatting, social engagement, ventral vagus. We've got its hybrid with sympathetic, which is sport. We've got its hybrid with the dorsal vagal, which is pillow talk. And we've got the dorsal vagal itself, which at the base level, at the beginning level, is rest and digest, but can go into collapse, which is the kind of hybrid with sympathetic. So we've got all these different responses. And one of the key elements of all of those nervous system responses is they're all connected to breathing. They're all connected to breathing. Now, a baby learns to tone its vagus nerve by breastfeeding. So when a baby sucks a nipple, that suction and the ventral body-based contact with the mother teaches the baby how to access that rest, both rest and digest, the dorsal vagal, but also the comfort and warmth of social engagement and how to tone the vagus nerve. If babies don't get that so much, they tend to struggle with that. There is a suggestion that some children with ADHD and autistic responses to life may well struggle to be in the social engagement spectrum. They're either in dorsal vagal function of collapse, or they're in the stress response, and they're missing the capacity to be in ventral vagal and social engagement, reading other systems, paying attention to their own. By reading systems, I mean paying attention to non-verbal communication, the meanings behind words, and so on. Yeah? So breath work can help with that. So we're going to go through some practices which enable that. And of course, when we breathe in and emphasize the in-breath, that's going to switch on the ventral vagus nerve. Of the 100% of information flow, our biological system is information flow. It's neural feedback loops. 80% of that is going from the body up to the brain, not the other way around. So when we take a full deep in-breath, the stretch receptors in the lungs, the change in heart rate variability, the fluids flowing back into the lungs, all that information is being monitored, and that information is going to the brain. So think about collapse for a minute. Just collapse your body, collapse your life, collapse everything, and notice your posture, notice how you go in yourself. It's a quality of breathing. Take an in-breath. It lifts you out of that. So we can use breath to switch on ventral vagal. So if somebody's in a dorsal vagal response, collapse, difficult collapse, we can start to initiate the inhale to help them to get it, along with other strategies, of course, to help them lift out of that. Yeah. If we can work with balances of breath, balances of the in-breath and out-breath, it's an addition into the idea of supercoherence, then it changes those functions. Now, okay so far with that level of information. Great. I'm going to add in a bit more, which is this. The opposite of the sympathetic nervous system response, fight and flight, is not just parasympathetic, the relaxation response. Yeah. It's actually engagement, positive engagement. Now, positive engagement, where we feel great and we want to do that thing, we want to get on with it, that is fueled by a hormone called DHEA, dehydroepiandrosterone. DHEA. And DHEA kicks in when we're feeling motivated, empowered, wanting to do something, and it gives us the edge. So, if we feel stressed, the opposite to stress is not just relaxation. Relaxation is helpful. It's more of a triangle where we get stress, relaxation, and the optimized state of DHEA. So really, we're using relaxation just as part of a strategy of switching on towards optimal function, which where we're rippling with DHEA. And DHEA is the precursor hormones for both estrogens and testosterone. Yeah. And both of those are very, very powerful in terms of our motivation, brain states, and everything else like that. So we'll be doing more practices on that later, but first of all, let's come into a couple of breath practices to look at a bit more fully at vagal tone. You're going to get some PDFs with all this information on. You know that on the with this comes all the information written down for you, so you're going to get access to all of that. You don't just have to tune in, pick it up now. However, when you are listening to me talking like this, I highly recommend you go into super coherence breath. You tune in, go into that breath wave state, and it will enable you to access that information and remember it and learn super quick. Okay, let's look at some breaths.